Hello everyone, I am Dr. Ponkhi Sharma. I am a physiotherapist and founder of Curis 360 Physiotherapy Clinic, Bengaluru. So today we are going to talk about cupping therapy, which is a part of physiotherapy, and this cupping therapy is used as a part of myofascial release. This cupping therapy has lots of benefit in many cases. So let's understand how this cupping therapy helps. This cup actually pulls the skin up, which creates a bubble in our skin, and when we creates a bubble in our skin, it actually produces a decompress to the skin and the underlying structures. When we use this decompress therapy, it actually releases the pressure and the compression on our soft tissue, that is on the fascia or the muscles or the blood vessels. So generally what happens when a constant stress fall on a particular area, or it's a chronic pain or chronic inflammatory conditions, there will be a adhesion formation underneath our skin, and this adhesion formation actually restrict the blood flow to that area. As there is a restriction of blood flow to that area, the inflammatory conditions increases, and as the inflammatory condition increases, we get the pain. So sometimes even though we have taken the utmost care, we may not be able to recover from the pain completely, or sometimes the pain goes away but reoccur again. To reduce the reoccurrence and also to recover in a faster way, we use this cupping therapy. I'll be showing you now how does it actually work and how does we place it on a patient's skin. First, we use a little bit of gel, or we can use Vaseline, or we can use oil, and this is used just to reduce the restriction of the skin. So when we apply this, it actually does not cause much of irritations on the skin, and that's why it's very important that we actually grease up the area first. And then we place the cup over here. So I have a suction cup. There are different types of cup. Which I use is the suction cup. We place it over here. We use this gun and we just pull it. So like this, the skin going to bubble up, and the physiotherapist, experienced and a certified physiotherapist, will be able to give the exact pressure required for this. And when we apply this, as you can see, the skin bubbles up, the compression between the skin and the underlying structure get reduced, and because of this, the blood flow will rush to this area. This is going to reduce the scar tissue formations and also reduce the friction between the skin and the muscles, and then the movement of that area will become more flexible. Basically, it's a natural way of healing the area by improving the blood circulation. To reduce the pressure, we just lift up this, reduce the pressure and remove this off. There are different ways of doing this cupping therapy. It can be just a static therapy, like we place it on there and we produce the suction. There can be a dynamic cupping done where we move the cup from one place to another, or also another way of it is like we put the cup and we move the area which has been affected. So there are different techniques used according to the conditions, and what to be used is actually decided by a physiotherapist. In what all condition this cupping can help you? It can help you in a chronic pain, example a slip disc bulge which is giving you constant pain on your back. It can also be used for neck pain, radiating pain. It can also be used to reduce the trigger points or the muscle knots. So multiple conditions where a person feels lots of pain, or the pain is there from long period of time, it fastens up the recovery, and it definitely helps to a great extent. It works miracle to reduce the pain faster and to get the complete recovery.